President Cyril Ramaphosa has just confirmed that the National State of Disaster Declaration, breaking news tonight, comes to an end at midnight. That means that the rules or the powers that were tapped into during that period in the COVID-19 pandemic for about 750 days, as the President has said, have come to an end. But this is with some conditions, because for the next 30 days, there will still be some level of regulation around the country's response to COVID-19. For example, you will still be required to wear a face mask when you are indoors. The President saying for travellers in and out of South Africa, well, coming into South Africa really from overseas destinations and other countries, even on the continent, those travellers will still be able to produce a COVID-19 vaccination certificate. Those who don't have a vaccine certificate will then have to prove that they're COVID negative. That test not allowed to be older than 72 hours. Now, if you are coming into South Africa and you don't have a negative COVID-19 test upon arrival and you're not vaccinated, what you will then have to do is take a rapid antigen test at the airport before you are allowed entry into the country. Now, just on restrictions around gatherings, because this is always a hot topic around these addresses by the President, and I want to get this right. The restrictions on large gatherings remain. Places like stadiums, for example, those 1,000-seater churches, those churches and other large venues, shall we say, will still be allowed to fill up to 50% capacity. Even then, the people will either have to be vaccinated or prove that they are or tested negative for COVID-19 within a 72-hour window. Only gatherings of 1,000 people indoors can be allowed without the requirement for a COVID-19 vaccination certificate or a negative test. 2,000 if you are outdoors. But once you exceed those limits, then you will definitely have to produce either a negative test, once again, not older than 72 hours, or prove that you are vaccinated. The President said that while we end the state of disaster declaration at midnight tonight, it means that South Africa, he believes, South Africa is hopeful that we are now through the worst of the pandemic. He also then said that it is a time for South Africans to take individual responsibility in the months and years ahead, because COVID-19, even according to all the scientists globally, is going to stay with us for a long time to come. Let's quickly get you the response and reaction then. We're joined now by Professor Mosa Moshabela from the University of KwaZulu-Natal. Prof, has government managed to walk this line in the right way on COVID-19 going forward?
Good evening, Thembekile, and to the viewers. I think that it was a fine balancing act, and I think that there are some important compromises. Firstly, just doing away with the national state of disaster in itself, it's a major step to restore trust, and the President made specific mention of the issues of powers, the centralization of power. And I think that that is important to note, but also I think some sort of relaxation around the entry into the country using an antigen test was really important. And the specific mention of the vaccine side effects, I think those were key announcements tonight that the President made. But it is a fine balance, and I think it's fair enough. And as you indicated, the individual responsibility now kicks into play going forward.
And Prof, let me pick up on the requirement for travellers to produce that negative test, not older than 72 hours, as we've been stressing, prove that they are vaccinated otherwise, or indeed take the rapid test at the airport. How much of a risk would international infections, importing those, be to the South African population, given that already we're not testing anyone who's not incredibly ill or in hospital?
Yeah, I think that the issue of travel is about the fact that, when people are coming in, they could bring unique viruses or variants as opposed to local transmission of dominant strains or dominant variants, virus types that we have. Really, that's where the main issue is. It's not so much about the volume of infections. It's more about the type of virus that may be introduced through international travel coming from other parts of the world. I think that's what we need to focus on.
And if we're doing away, well, not doing away, but if the President, as he was emphasizing today, that we're going into a period where individual action, individual responsibility will determine our course of COVID-19, why not do away with all regulations, except, of course, the regulations that deal with the economic aspects of the pandemic?
Yeah, no, I think it's an important question, Thembekile. I think the main issue we have to remember is that the key message is that the disaster is ending and is considered to have ended now, but the pandemic is not over. The measures that we may need to manage the infections, not only now when the cases are low, but also in the event of having a fifth wave. That's why the president made reference to increases in cases in other parts of the world. It's a clear message that recognizes that the infections are not necessarily over across the world. So this may also affect us in South Africa. So we may need those measures to manage the pandemic.
There is reporting today, and we were discussing this earlier with Professor Alex van den Heever, about a new COVID-19 variant, possibly a child of Omicron, now detected in the United Kingdom. How closely should our scientists be monitoring that, especially during this 30-day window where we're crafting new regulations? And what role should it play, possibly, in shaping what we do next?
Yeah, I think that Thembekile, we can be reassured that our scientists are monitoring the variants, and whenever we hear of these variants that are detected elsewhere, we pay attention to them. And it is something that, for us, it's a make or break when it comes to how we approach whatever next surge of infections we may face. So if we fail to actually conduct our surveillance and pick up on these variants, it will make it difficult for us to anticipate, to respond, and to respond in time. As you have seen in the past, whenever we are able to pick up a particular variant, we are then able to characterize it and we know exactly how to respond to it. So we've got the systems in place, we've got the expertise in South Africa, and we can have the confidence that our South African scientists would then be able to pick up any variant that may emerge.
Professor Mosa Moshabela from the University of KwaZulu-Natal, always good to speak to you, sir. Thank you very much for your time.